Cryptosporidiosis is a highly contagious intestinal infection caused by the microscopic parasite Cryptosporidium, which can affect anyone, but is especially dangerous for young children and individuals with weakened immune systems. Individuals with the disease often suffer from watery diarrhea, which is the most common symptom, but they may also experience stomach cramps, dehydration, nausea, vomiting, and a low-grade fever. The symptoms can be mild to severe and can lead to significant weight loss and malnutrition if not addressed properly. While there is no specific treatment for cryptosporidiosis, the focus is typically on alleviating symptoms and ensuring adequate hydration. In some cases, antiparasitic medications may be prescribed. People are at higher risk of contracting cryptosporidiosis when they drink contaminated water, including recreational water in swimming pools, come into contact with infected animals, or consume contaminated food. To understand how to better protect yourself and what to do if you suspect you have contracted cryptosporidiosis, let's delve into the detailed aspects of the disease. Symptoms and progression of cryptosporidiosis. Cryptosporidiosis caused by the Cryptosporidium parasite typically manifests as watery diarrhea, often accompanied by stomach cramps, dehydration, nausea, vomiting, fever, and weight loss. These symptoms can appear within 2 to 10 days after exposure and can come and go in cycles, particularly in immunocompromised individuals, where the infection may become severe and life-threatening. In healthy people, symptoms may last for up to 2 weeks. However, even after symptoms have subsided, infected individuals can still spread the parasite for at least 2 weeks, making it crucial to maintain good hygiene practices to prevent transmission. Monitoring the progression of cryptosporidiosis is vital as it ensures timely intervention, significantly in vulnerable populations such as children and the immune-compromised, where the disease can be particularly relentless. Diagnosis of cryptosporidiosis. Cryptosporidiosis caused by the protozoan parasite Cryptosporidium presents with gastrointestinal symptoms such as diarrhea, which can be severe in immunocompromised individuals. Accurate diagnosis hinges on the detection of oocysts in stool samples, customarily through acid-fast staining or fluorescent antibody tests. However, these methods can lack sensitivity. Rapid diagnostic tests, including enzyme immunoassays, EIAs, and nucleic acid amplification tests, NATs, have improved detection rates. NOTs are particularly valuable as they possess high sensitivity and specificity, enabling the differentiation of Cryptosporidium species and subtypes, crucial for outbreak investigations and understanding transmission dynamics. Nonetheless, these advanced diagnostic tools might not be readily available in all regions, particularly in resource-limited settings where the disease is most prevalent. Cause and risk factor of cryptosporidiosis. Cryptosporidiosis, a gastrointestinal illness caused by the Cryptosporidium parasite, primarily attacks the small intestine, leading to diarrhea, abdominal pain, and dehydration. It is zoonotic, meaning it can be transmitted to humans from animals. The highest risk of infection is through contact with contaminated water, as Cryptosporidium oocysts are resistant to chlorine and can survive in public water supplies. Recreational waters such as swimming pools and water parks are common infection sites. Other risk factors include exposure to infected animals, especially young livestock, or contact with feces through caregiving or sexual activity that involves the potential for fecal exposure. Individuals with weakened immune systems, such as those with HIV/AIDS, are at higher risk for severe and prolonged illness. Proper hygiene, water treatment, and safe handling of food are critical preventive measures to reduce the risk of cryptosporidiosis. Treatment and management of cryptosporidiosis. In managing cryptosporidiosis, a disease caused by the parasite Cryptosporidium, the focus is on alleviating symptoms and addressing fluid and electrolyte balance due to diarrhea. While the illness often resolves on its own in healthy individuals, it can be severe in immunocompromised patients. Antiparasitic medications like nitazoxanide are approved for treatment, but their effectiveness can vary. There's no vaccine, making prevention key, especially in high-risk groups. Ensuring access to clean water, good hygiene, and safe food practices are essential, as Cryptosporidium is resistant to common chlorine disinfection and can thrive in various environments, posing challenges for public health initiatives and necessitating robust water treatment protocols.